Hi, this is Lindsay Galing doing the SBAR activity for the Foundations of Nursing class. I got scenario number 2, which is Miss S is a 72-year-old retired school teacher. She lives alone with her dog Ginger and is very independent. She was shoveling snow on Monday morning after the big snowstorm. While shoveling, she developed a crushing sensation in her chest. This is not the first time she has had chest pain. Miss S has a history of angina, though she has never had a heart attack. She takes an aspirin every day at home and keeps nitroglycerin tabs in her pocket just in case. Miss S took a nitroglycerin tab and an aspirin and drove herself to the hospital. Miss S was admitted to the hospital on Monday afternoon with chest pain. They ruled out a myocardial infarction. She has been a patient on the cardiology floor for 4 days now. She has no chest pain since Monday and has been ruled out for a heart attack. She has an IV of 0.9 NS at Keep Open and expects to go home in the morning. At 2200 hours, Miss S put her call light on. Her nurse answered the call light. Miss S stated that she was having chest pain and rated it at a 9 out of 10 on the pain scale. The nurse had the PCA check her vitals and get a EKG. The nurse went to grab her a nitroglycerin tab. Miss S's blood pressure was at 90/52. Her EKG shows ST wave changes. Her heart rate was at 120 beats per minute. Her breathing was labored at 36 breaths per minute, and her pulse ox was at 85% room air. She gave Miss S a nitroglycerin tab sublingually. There was no relief to her chest pain, and her blood pressure decreased to 80/52. The nurse placed Miss S on oxygen at 2 liters, and her pulse ox improved to 91%. Miss S is very anxious and states she feels terrible. The nurse increased her IV fluids to 100 cc's an hour and called the physician. So I'm going to discuss some permanent data from the scenario through SBAR. The situation is that Miss S is having a heart attack, I believe, but you cannot give her any more nitroglycerin tabs because her blood pressure keeps dropping. She has had an aspirin in the morning every day that she's been there, and to keep her blood thin, so that's good, so it's not going to cause her a stroke. And her oxygen is improving with 2 liters of oxygen from 85% to 91%. And I also would have given her the 100 cc's of IV fluid so that by the time you're calling the physician, the blood pressure is already rising. And then I also do believe she's experiencing a heart attack because she's feeling anxious and like things aren't getting any better. Her background is also that she's had angina, a history of it before, and she may not have had heart attacks previously because she does take a nitro tab and aspirin. And so when she's having those chest pains, she's getting vasodilation in the arteries, so it keeps her from the heart from working too hard and having a heart attack. In my assessment, I believe that she is having a heart attack due to the ST wave changes. She has the high heart rate, the labored breathing, and she continues to have low oxygen, but it improves with her pulse ox improves with adding 2 liters of oxygen. So I believe that her situation gets better with oxygen. So there's a blockage somewhere causing the heart attack. In my recommendation, if I was the nurse, I would get a blood sample to test for enzymes that show heart damage from a heart attack to see if those are present, to see if they're treating for a heart attack. I would give Miss S an antiplatelet agent to prevent from clots forming while she's having the heart attack, to prevent a stroke. I don't think that until her blood pressure has raised, there isn't really any medications that you can give her because it's going to lower her blood pressure even more. So all you can do until that blood pressure increases is give her fluids to increase the blood pressure. Other than that, there isn't much you can do for her. She'll fall even more into hypotension if you give her any of those, like an ACE blocker, or beta blocker, any of those types of things. This is the mini simulation portion. I'm going to be the doctor and my mom's going to be the nurse.
Hi, Dr. Smith. This is the nurse calling to inform you about a change in condition to Miss S.
Okay, what is she experiencing?
I believe she is having a heart attack. Miss S has chest pain, 9 out of 10 on the pain scale, a heart rate of 120 beats per minute, labored breathing at 36 breaths per minute. Her pulse ox on room air was at 85%, and her blood pressure is at 80/52.
What have you already done to try and help her?
I have given her an EKG, and it shows a change in the ST wave. I put her on 2 liters of oxygen, and her pulse ox has increased to 91%. I gave her 2 nitro tabs, but the problem is every time I give her a nitro tab, her blood pressure continues to drop. So I increased her IV fluids to 100 cc's per hour.
Okay, that sounds about all you can do right now. Keep her stable until her blood pressure has increased. Given the state of her nature, I would give her more IV fluids, and then after her blood pressure has gone up, I would give her a beta blocker. I will send over a prescription for a beta blocker. Keep me updated.
Thank you. I will keep you posted.
And then the debrief. What were your thoughts on the clinical scenario? I thought that the scenario was really good. It's something that would have happened in the nursing world. When I first started, I was a little confused because I forgot that nitroglycerin tabs they might lower your blood pressure. And so it was a good thing that she didn't give her any more nitroglycerin tabs, and that before she called the physician, she gave that patient fluids so that if he did prescribe a beta blocker, she could, when it got to a certain point and back up to normal, he could prescribe a beta blocker, and that the nurse could then administer it. What do you think could have been added to the SBAR? I think a reevaluation of the patient could have been added to the SBAR. After the nurse puts those steps into place, I would have liked to reevaluate the patient and see the outcome of them. That's the only thing with SBAR, is that you don't see that reevaluation. I wanted, after I gave a beta blocker when her blood pressure came back up, I would have liked to, see that she came off of the room air, she was back on room air, and that the beta blocker helped stop the heart attack, and she's on that beta blocker now, and so she won't have any more heart attacks. What do you think we need to do in the SBAR? What do you think we do not need in the SBAR? I think that everything is important in the SBAR. Every step leads to one another. You have the situation, background, assessment, recommendation, and that's all important into making a decision and helping the patient. If I could do this conversation again, what would I do differently? If I could do this conversation again, I don't think I would change anything. I really liked the way that the nurse handled this situation. She didn't administer the second nitroglycerin tab because she took the blood pressure, and she knew that if she gave her fluids, that it would, before she called the physician, that it would start to raise her blood pressure. And if he did prescribe her a beta blocker, that she could give it to her right away. So that's just being prepared and being able to help the patient as much as possible. Do you think the significance of the situation was clearly presented to the physician? I do think that it was clearly presented to the physician. I told her what was going on, the history, what I already did to help her, and he specifically told me things that I could do to help her while her I couldn't do anything to help her while her blood pressure was going back up.